Hi folks, let's talk about depression. Depression is a worldwide problem. In the United States, annually, approximately 1 out of every 10 adults will be challenged by depression, with rates for women being twice as high for men. The World Health Organization has identified that depression is the leading cause of disability worldwide, and it is well known for the role it plays in suicide. How many types of depression are there? The DSM-5 identifies 8 types of depression. I'd like to tell you a little something about each one. Major depressive disorder is a condition that lasts a minimum of 2 weeks that causes significant impairment in one's life. Some of the common symptoms include feeling overwhelmingly sad, having little energy, having poor sleep and or poor appetite, and having difficulty concentrating. Some people have feelings of worthlessness and have thoughts of death and or suicide. This type of depression falls into 3 categories: mild, moderate, or severe. Next, persistent depressive disorder, previously called dysthymia. This is a continuous long-term form of depression, often presenting as a personality type. For example, like Eeyore in Winnie the Pooh. Eeyore presents as having persistent depressive disorder. Unlike major depressive disorder, PDD does not usually let up. As you would imagine, this type of persistent depression could cause problems in relationships, work, school, and other social settings. Disruptive mood dysregulation disorder. This is a childhood condition in which the child is angry almost all of the time and often has way out of the norm tantrums that are not appropriate for a situation. Children and adolescents often experience depression much differently than adults. With DMDD, the child's emotions and behaviors are uncontrollable and are very problematic for the child. Premenstrual dysphoric disorder. In some ways, it's like premenstrual syndrome, but much more severe. PDD affects women of childbearing years. It can involve a number of psychological symptoms that include depression, anxiety, irritability, mood swings. It may also involve cognitive impairments that include difficulty concentrating and confusion. Neurological and vascular symptoms may be present too. For example, headaches, dizziness, heart palpitations, and bruising. Other types of physiological problems may be present that include fluid retention, respiratory problems, vision problems, gastrointestinal problems, and problems with her skin. Substance/medication-induced depressive disorder. This type of depression is the direct result of having taken in a substance like alcohol, cocaine, methamphetamines, or it may be the result of taking in a medication. Some medications to treat conditions like cancer and hepatitis C are known to cause depression. Once the individual stops the substance use or the medication, the depression most often resolves. In terms of medication, the benefit of the medication, say in the treatment of cancer or hepatitis C, often outweigh the harm it may cause. in this case, depression. So the individual takes the medication until their medication is no longer needed. Depressive disorder due to another medical condition. It is known that certain types of medical conditions cause depression. Medical conditions that include hypothyroidism, diabetes, and traumatic brain injury. Like other types of depression, these individuals will often benefit from medication and psychotherapy. In the case of traumatic brain injury, the depression associated with this condition may be lifelong. Other specified depressive disorder. This diagnosis is usually given when the patient presents with depression but does not have all of the symptoms to meet the criteria for one of the types of depression just discussed. Lastly, unspecified depressive disorder is a type of diagnosis used when the patient is presenting with depression. However, there is not enough information to make a more specific depressive diagnosis. If you or someone you know is challenged by some of the difficulties that were just discussed in this video, seek mental health services. Begin by getting a mental health evaluation. This can be done by using the traditional approach by finding a mental health specialist or an agency that has expertise in mental health disorders, and then go into the facility for an evaluation. However, since the pandemic, many agencies and providers in private practice make seeking telemental health services online easy and convenient. If you're interested in how a mental health evaluation is performed, for example, depression, look at my video on how is depression assessed. I hope you found this presentation helpful. Thank you for supporting this channel. Take care of yourself and be safe.